family medical centers are a primary care group. It's a preventive medicine concept. Preventive medicine is about trying to reduce bad outcomes for people by getting ahead of problems.
Our mission was to be able to provide quality health care. We started out as a Rural Health Initiative program at first.
We're here.
And we care.
Nobody should go without health care. There's no excuse for anybody in Lawrence County to go without health care. It's accessible, and if the concern is, well, I don't have the money to go, someone's going to help you.
When John Kennedy was running for president, he done a tour through West Virginia, and he saw poverty was just rampant. Unemployment was high. Families had a lot of children. I mean, it was pretty destitute. And he made a pledge or made a promise that if he was elected president, that he was going to try to do something about that. And then when Lyndon Johnson assumed the presidency, he took much of the legislation that Kennedy had started to prepare and finished the work on it. The people back then had a much different attitude. I don't need the government's help. I'll be fine. Don't worry about us, we'll take care of ourselves. Well, they weren't taking care of themselves because they didn't have access. We got a program funded through the Office of Economic Opportunity called Project Upgrade, and it was one of the first programs funded in the United States that addressed the issue of health care. We had a total budget of $105,000. We had one physician, who was Dr. Evelyn Kemp. We had one clinic a week in Gallia Meigs, one clinic a week in Jackson-Benton, and one clinic a week in Lawrence. And Dr. Kemp traveled those 5 counties providing medical care for the people that we were able to identify and bring in. At the end of that first year, OEO, Office of Economic Opportunity, asked individual counties to pick it up on their own and to pursue it. The first clinic we had was here in Ironton, in the old church on the corner of 6th and Vernon. And it was just one big room. It was a beginning.
We had one set of scales, one blood pressure cuff and stethoscope. When we would go and do Head Start physicals, we didn't actually have an exam table. We would cover a desk with a sheet. That was our exam table back then.
Mid-70s, I think 75 or 76, we completed the transaction to buy the Campbell Building here in Ironton, and that's when we were able to upgrade ourselves a little bit. We remodeled the back garage, separated it into exam rooms, and was able to have a doctor on staff full-time.
When I first came to work with the CAO, we had one small clinic. It was one doctor, one nurse practitioner, and 2 nurses is what we had. So that's what consisted of the whole clinic there. So you pretty much done a little bit of everything that there was to do. We now have spread out to all points of the county that we're at now. So 7 different sites that we have. But I still believe it's the same mission that we started out with in the very beginning, to be able to reach out to the people that really need the help.
The community health centers have a uniqueness about them that they can treat the patient wholly. If they don't have a job, we can send them down to the job center down here and try to help them find a job. So it's not just healthcare, it's all of the other components that go along with it that makes it important.
We serve all insurance. We, take about every insurance they are, and like you said, we have the sliding scale. If they don't have it, we accommodate them with that.
It's not just you come in and we deal with what you have, which of course we're very happy to do, but we're always going to try to push beyond and give you the opportunity to really think about where you are and try to be proactive.
It's a wonderful organization. It's wonderful to be able to provide the care to people, no matter what your income status may be.
The CAO has a service that can almost take care of about any situation. And basically, we've got people that if we can't take care of it, we can find somebody that'll take care of it.
It's gratifying to see these patients come back in and be so thankful for things that have been done for them.
It belongs to everybody, and we need to get everybody to participate in it. And if you want good health care, you can get it here. I mean, it's available.